One limitation of follicular unit extraction techniques versus strips has been the general exception and adaptability for traditional strip surgeons. And the arguments that are out there are based on really a poor understanding of the FUE process. In many instances, a traditional strip transplant surgeon may claim that follicular unit extraction techniques will yield less dense hair. Now, that may be true along a learning curve for someone who's first starting out in using that technique, but through time and through using the right punch devices with the right diameter, this certainly can be avoided altogether. A second proponent of follicular unit extraction technique has been the ability to convert a hair loss patient who would not necessarily be a candidate for a strip technique. Those candidates would be someone who is extremely young at age where preventative measures have failed, and someone who's wishing to reestablish a hairline. Through the use of follicular unit extraction techniques, you're not committing to someone to although well tolerated, a linear scar in the back of their head. Also, the issue of thinning can also be really compounded with sparseness. So the number of hair follicles and the quality of the hair being very thin can be two issues sort of running concurrently that render someone not a candidate for a traditional strip technique. So if one imagines, if you don't have a lot of hair in the back of your head, you can't really hide a scar. And so those patients would be perfect candidates for either a mechanical follicular unit extraction technique or certainly the robotic follicular unit extraction technique in our practice. One of the initial problems with follicular unit extraction techniques, especially in new providers who are trying to add this to their array of skill sets, is the problem with transection. And a transection occurs when a hair is dissociated from its follicle. Now, in traditional strip techniques, transections are essentially more significant than they are in a follicular unit extraction technique. For example, in the individual graft technique where you are trying to remove a follicular unit using a blunt 1 millimeter or even 0.8 millimeter device, if a transection occurs, the follicle still remains inside the scalp. In the case of a strip surgery, if the follicle is transected, it remains extracorporeal and ends up in the trash can. Graft transections have been a long time problem with follicular unit extraction techniques, and this was no different in the evolution of the robot. They're currently undergoing additional transection rates of the robot at the Denver Health Sciences Center. They're up to approximately 80 patients in that study. It's an ongoing study conducted with a principal investigator being Jim Harris, and he is reporting in the Caucasian patients that the best transection rates are on the average of about 2 to 2.5%. This is well below a human transection rate in someone who's particularly skilled at the procedure of about a 6 to 8% transection rate.